This is LiveWell Talk on COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. The COVID-19 pandemic remains the top news story and probably will through most of the spring and into the summer. This continues to be a rapidly evolving situation. This podcast is being recorded on March 27th. On this date, the United States has taken over the lead for the number of cases in the world. What have we learned? We've learned that the COVID-19 virus can spread rapidly. Highly populated areas are more at risk. I heard an excellent analogy the other day that the city of New York has a population density of 28,000 people per square mile. Linn County is about 290. And each apartment building in New York City may have over 1,000 people. So essentially, each apartment building in New York City is a cruise ship. And these multiple cruise ships can spread contagions quickly, hence leading to the epicenter. Now, this morning, they're considering that the next epicenter of the disease may possibly be New Orleans due to socioeconomic issues, healthcare infrastructure at baseline, and the Mardi Gras, which attracted people from all over the world, which may have injected, no pun intended, the virus into the community. We've learned a lot in the last 14 to 20 days about ourselves. We know what we do, we know how we do it, and each of us is learning why we do it. We're concerned about our loved ones and our family, but we're also concerned about our neighbors. The pseudo shelter in place that we're at right now is preventing people from having their livelihood, and that's adds stress, and stress leads to illness. So we're all worried about our neighbors, and we should look out for our neighbors. We do know from a hospital standpoint that personal protective equipment is certainly scarce, but still present if we use it wisely. When taking care of a COVID patient and they're not in an aerosol generating procedure or situation, then simply droplet precautions is satisfactory. And then airborne, if an airborne procedure or aerosol generating procedure is present, you don't need more than that. Wearing a mask just down the street, all you're doing there is preventing yourself from spreading whatever you have. You're not protecting yourself from receiving something. But if you feel comfortable doing that, then please do it. But it really comes back to the 3 C's. Clean your hands repeatedly. As I've said before, I say 2 Hail Marys, but another great analogy that Dr. McGrail uses, and I really like it, is wash your hands as if you just touched a hot jalapeno and you don't want to touch your eyes, so wash intensely. Cover your cough and your sneeze, and contain yourself if you're sick. I can't stress enough to stay home if you don't feel well. That's in healthcare, we consider it a sign of weakness when healthcare workers call in sick, and we have to change that mentality and change it now. I've been using an analogy to reinforce to people why we need this pseudo shelter in place. There's 3 buckets to any model of an epidemic. There is the susceptible population, which that's all of us because this is a novel virus. Nobody has immunity to it. There's the infected population or infectious, and then the recovered. The total recovery in the United States is about 1,800 today, but total cases are 85,000 over that. In Iowa, 179, 180. So what we're trying to do by shelter in place and self-isolation is not allow the infectious population to touch or come in contact with the susceptible population. Because for every infectious person that touches, if you will, a non-infectious person, it leads to 4 cases. And those people each lead to 4 more cases. And those people each the 4 more cases. And it doesn't take long to understand how this can rapidly spread and overwhelm a healthcare system. Are we prepared for a surge of patients? Absolutely. The resources have been dedicated. There's contingency plans upon contingency plans. But if it should all happen at once, we could never possibly prepare for that. And that's why we want to self-isolate and flatten the curve. Personally, I think this will probably spike about around April 18th or 20th here in our community. It'll taper off after that time, but I do believe it'll be with us through the summer, and we may see a spike again in the fall. But most of all, follow the 3 C's, stay healthy, be smart, and look out for your neighbors and loved ones. For the most up-to-date information on COVID-19, visit our website at unitypoint.org or the Centers of Disease Control and Prevention website at cdc.gov. If you have a topic you'd like to suggest for our Talk On podcast, shoot us an email at stlukescr@unitypoint.org. We encourage you to tell your family, friends, neighbors, strangers about our podcast. Until next time, be well.